So hi Anindita, thank you so much for joining us today. And as we're sitting here in Mahabalipuram, I'd like to have you share a bit about your organization. And yeah, that's where we'll begin from.
Uh, I talking about my organization. So I work in SNEHA, where we walk in the mostly in the urban informal settlements of Mumbai, all across, and also in parts of different parts of Maharashtra also.
Interesting.
And some of the core areas that we work are in maternal and child health. We work on violence against women and children. We work with adolescent. We work with hospitals. We also work with palliative care. We work with adolescent people. So these are few core areas where we work, and so it's. We are now in the 25th year running, and
Nice.
we have a big team.
Yeah.
And I'm from the monitoring and evaluation team, and we are more or less focused on making people sustain, the community sustain, being aware of the situations or the problems, and then it's sort of like a mixed intervention from the community team and also from experts within the SNEHA team for a better world and for better purpose. That's
Lovely.
it.
And like you said that you're working with the M&E team, so you deal with a lot of data.
Yes.
And also the areas that you talked about, so the child and maternal health, the domestic violence cases, this is also sensitive data that you deal with. Not
Yes.
everyone can be sharing that data with anyone.
Absolutely.
And you can't risk that data being out.
Yes.
Because that's very sensitive. So on that front, what are the challenges with data specifically that you've been facing? And if you can also shed some light on these challenges before your experience with having used Dalgo, and why did you choose Dalgo?
So first, regarding the privacy of information, so we have to the consent forms we have, which we have to get it signed before having any discussion or any intervention with any of the people we are working with. So once they agree to that, then only we have the right to get any information from them. So that's one checkpoint. And then coming to it, so for us, we do not reveal any like individual cases or any situations with any of our external people. So it's up to us only. So in that way we have like a unique ID. So rather than having the people with the names, we have IDs, which is like somehow it helps us in bringing the anonymity. And regarding the vastness of the data, we do have a large set of data, and as it's a organization which has been working for so long, so the data is becoming more and more, and it was becoming a bit challenging when we are so the pre-Dalgo period, where we had like lot of like manual data mining, and like we used to use some statistical software which we still use, but we had like for the visualizations, it was not it was on a monthly basis or according to the requirement we used to do the data. But now the moving into the Dalgo, or we have like lot of dashboards in Superset. So it's first of the benefit of it is it's a real-time data. So that is helping us a lot. That is helping all the level of people in the organization. Particularly for the monitoring and evaluation team, it is more prominent because now we can see a clear picture and we can guide the program. And each user is also being able to see what the data they are doing. So once they fill whatever the work they are doing today, so by tomorrow they can go back and check what actually they have done. So that is bringing a lot of meaningful impact in the team also.
Great. And like you said, so if it's the real-time data that you're looking for, and that's what Dalgo is filling in for you. And since you're also working with these cases which cannot be delayed,
yes,
which have a time period to solve them, like maternal health. I mean, there's a window of 1,000 periods for nutrition for a kid. With domestic violence, you cannot wait for it to actually get worse. So that actually makes sense that the real-time data would have an effect on those beneficiaries. But apart from these, are there any other challenging areas with data that you're looking to solve? And any expectations from Dalgo on how they can improve or make additions that'll kind of ease your work out?
To be honest, because of the so it's a challenging environment where the requirement from the funders, the requirement from the team, from the program team who are actually working in the field, that is increasing. And also, if you look into the analysis perspective, we also are deep diving to a lot of other aspects of the data. So when we are defining a set of indicators or parameters on which we would like to see the dashboard, it's changing.
Sure.
And the way it is changing, it becomes like the things get stacked in the pipeline. So maybe the turnaround time would be something we would be expecting from Dalgo. So if it could be done, because it's such a sort of an engineering which requires some sort of skill to get adapted, and it cannot be in a click, it cannot be changed.
Exactly.
So if there is a one change in one indicator or one additional thing is getting in, so we have to wait for a time period to make it done and to get that data reflected in the superset.
Okay.
So that's where that's one thing which we feel that if we can have a more probably training or whatever efficiency it could be, so that challenge could be solved, that is something. And also, as we were discussing in the sessions, that creating a storyline. So maybe from the top management level, or when we're going for dissemination, so it's people may want to look at a glance to what the exact indicators look, how we are performing over the period. And for them, like going and selecting the filter or doing all the manual things, it may be time taking. So at a glance, if we can could have a platform where we can build a story and we can present it, so that would be more meaningful. Or maybe the reading from the data. So that would be something of help. So.
Because the way they say data tells a lot of stories, and at times it tells the stories that you want it to tell.
Yes.
And the kind of individual cases that you're dealing with are a lot of stories in themselves beyond numbers of you having resolved a social domestic violence issue or having helped a mother. So that is kind of where we are coming in from, where we are trying to make data much more simpler to digest, understand, and then create a story out of it. Because again, why the story matters is because the funders and the donors do not have that much time to go through the data, have a presentation done with big numbers being downloaded onto them. That now you make sense of it, or we've got big numbers, give us money. But if you tell them a story that we were able to reduce the time of reaching out to a person requiring help by this much amount, that makes a lot of difference, and it starts conversation, and that story is what they'll be wanting to be a part of. So today's session, like, we also talked about the features that are coming up. So any features that you're specifically looking forward to?
Probably I think we could use much of ChatGPT and all the features with Pratiksha was discussing, so where we can have more insights from the data. And even if from the data cleaning perspective also, if we get some intimations or some clues that where we should start. So in one of the session, we find out that we do not really know what's the fault is. We are looking into some other places where whether the problem is somewhere else. So in those sort of things, if we can get a handover of the AI and that can read our data, we can train the data in such a way that they will start throwing us some sort of interpretation leads. That would be much helpful because it can never replace the work that the analytics people and the human brain does, but still the leads would be really appreciated.
Great. And that's where technology is, right? It can just be an enabler. There still has to be some human intervention to kind of support it, make sure that it's still ethical, make sure that it still delivers something that's of value. And being in social sector, that is kind of what we're looking to create value, benefit people. And on a last note, what would be something that you'd like to share with the organizations who are starting on their data journey? Since it's a big bubble that they don't want to touch, because the moment it bursts, there's a lot more to do. So any suggestions for anyone who's trying to adopt?
So to be honest, what I have learned being in, so I feel the organization is growing so much, and we also have a very good platform and that seniors to help us to grow with the organization. So that's an added advantage which I would like to mention about my organization. And being here, I've seen that So the monitoring framework should be very much properly designed at the inception stage. So when suppose we are having a new proposal, from that time you should start looking into the literature and start developing feasible indicators or an LFA where you can pinpoint what exactly you're trying to do, what the funders are like to do with it, because you will get numerous variables. So you have to pin down what exactly is needed for you. So that exercise should be the beginning, and then you can develop the forms accordingly so that you can get a more concise version of the whole data. Maybe if you can collect like hundreds of data, maybe 10% of the data will be of your real use, or maybe those will be like impact indicators. So I think the monitoring and evaluation framework should be very strong, and it should be framed in such a way so that visualizations or any analysis you can go ahead with it. But the foundation should be strong in the research domain and the evaluation domain. That's what I feel.
Great. Thank you so much, Anindita. It's been wonderful having you.
Thank
and
you so
listening
much.
from you the story about SNEHA.
Thank
you
you
so much.